What is arrhythmia? Arrhythmia is a medical condition in which the heartbeat becomes irregular, too fast or too slow. It occurs when the electrical impulses that regulate the heart's rhythm are disrupted or blocked. What are the clinical features of arrhythmia? The clinical features of arrhythmia, or abnormal heart rhythm, can vary depending on the type and severity of the arrhythmia. Some people with arrhythmia may have no symptoms at all, while others may experience symptoms that range from mild to severe. Here are some common clinical features of arrhythmia. 1. Palpitations. This is a feeling of skipped or irregular heartbeats, or a fluttering sensation in the chest. 2. Chest discomfort. Some people with arrhythmia may experience chest pain or discomfort, similar to angina. 3. Shortness of breath. This is a feeling of breathlessness, or difficulty breathing, which can occur with exertion or at rest. 4. Dizziness or lightheadedness. Some people with arrhythmia may feel faint, dizzy, or lightheaded. 5. Fatigue. This is a feeling of tiredness or weakness, which can occur with exertion or at rest. 6. Syncope. This is a sudden loss of consciousness, or fainting, which can occur with certain types of arrhythmias. 7. Cardiac arrest. In severe cases, arrhythmia can lead to cardiac arrest, which is a medical emergency that requires immediate treatment. It is important to note that some people with arrhythmia may not experience any symptoms, while others may experience symptoms that are not related to the arrhythmia. If you experience any of the above symptoms, especially if they occur with exercise or physical activity, it is important to see a healthcare provider for an evaluation. What causes arrhythmia? There are many factors that can cause arrhythmia, or an abnormal heart rhythm. Some of the most common causes include 1. Heart disease. Many types of heart disease can cause arrhythmia, including coronary artery disease, heart valve problems, and congenital heart defects. 2. Electrolyte imbalances. Electrolytes are minerals in the body that help regulate the heart's electrical system. An imbalance in electrolytes, such as potassium, magnesium, or calcium, can cause arrhythmia. 3. Medications. Some medications can cause arrhythmia as a side effect, including certain antibiotics, antihistamines, and antiarrhythmic drugs. 4. Alcohol and drug use. Excessive alcohol consumption and drug use can cause arrhythmia. 5. High blood pressure. High blood pressure can cause the heart to work harder, which can lead to arrhythmia. 6. Thyroid problems. An overactive or underactive thyroid gland can cause arrhythmia. 7. Sleep apnea. This is a condition where a person stops breathing briefly during sleep. Sleep apnea can cause arrhythmia. 8. Stress and anxiety. Emotional stress and anxiety can cause arrhythmia in some people. 9. Age. As people age, the risk of developing arrhythmia increases. 10. Genetic factors. In some cases, arrhythmia can be caused by inherited genetic mutations. It is important to note that in some cases, the cause of arrhythmia may not be known. If you experience symptoms of arrhythmia, it is important to see a healthcare provider for an evaluation to determine the underlying cause and appropriate treatment. There are several types of arrhythmias, including 1. Atrial fibrillation, AFib. This is the most common type of arrhythmia, where the heart's upper chambers beat irregularly and rapidly. 2. Ventricular fibrillation, FIB. This is a serious type of arrhythmia where the heart's lower chambers beat irregularly and quickly. It can lead to sudden cardiac arrest and is a medical emergency. 3. Supraventricular tachycardia, SVT. This is a type of arrhythmia that begins in the heart's upper chambers and causes a fast heart rate. 4. Bradycardia. This is a type of arrhythmia where the heart beats too slowly. 5. Premature ventricular contractions, PVCs. This is a type of arrhythmia where the heart's lower chambers beat too soon. Arrhythmias can cause symptoms such as dizziness, shortness of breath, chest pain, and fainting. Treatment for arrhythmia depends on the type and severity of the condition, and may include medication, lifestyle changes, or medical procedures such as implantation of a pacemaker or defibrillator. What are the types of supraventricular arrhythmias? Supraventricular arrhythmias are abnormal heart rhythms that originate in the atria or the atrioventricular (AV) node. They are called supraventricular because they occur above the ventricles of the heart. There are several types of supraventricular arrhythmias, including 1. Atrial fibrillation, AFib. This is the most common type of supraventricular arrhythmia. It occurs when the heart's upper chambers, atria, beat irregularly and rapidly. 2. Atrial flutter. This is similar to AFib, but the atria beat in a regular, organized pattern instead of a chaotic one. 3. Paroxysmal supraventricular tachycardia, PSVT. This is a sudden, rapid heartbeat that starts and stops suddenly. It usually originates in the AV node. 4. Wolff-Parkinson-White, WPW, syndrome. Wolff-Parkinson-White, WPW, syndrome is a rare heart disorder that causes episodes of rapid heart rate, also known as tachycardia. It occurs when there is an extra electrical pathway in the heart that allows electrical signals to bypass the normal conduction system of the heart. This extra pathway is called the accessory pathway and can cause the heart to beat too fast or irregularly. The symptoms of WPW syndrome include palpitations, rapid heartbeat, chest pain, dizziness, and fainting. In some cases, people with WPW syndrome may have no symptoms at all. WPW syndrome. WPW syndrome can be diagnosed through an electrocardiogram, ECG, test, which measures the electrical activity of the heart. Treatment for WPW syndrome typically involves medications to control heart rate and rhythm, and in some cases, a procedure called catheter ablation may be recommended. This involves using a catheter to destroy the extra pathway in the heart. WPW syndrome is a relatively uncommon condition, and most people with the disorder are able to lead normal lives with appropriate treatment and management. However, in some cases, WPW syndrome can lead to serious complications, such as heart failure or sudden cardiac arrest, so it is important to seek medical attention if you experience any symptoms of the disorder. 5. Atrioventricular nodal reentrant tachycardia, ARRHYTHMIA. This is a type of PSVT that occurs when there are two pathways in the AV node that create a reentry circuit, causing the heart to beat too fast. Supraventricular arrhythmias can cause symptoms such as palpitations, shortness of breath, chest pain, and dizziness. Treatment options depend on the type and severity of the arrhythmia, and may include medications, lifestyle changes, or medical procedures such as catheter ablation or implantation of a pacemaker. What are the types of ventricular arrhythmias? Ventricular arrhythmias are abnormal heart rhythms that originate in the ventricles, the lower chambers of the heart. They can be life-threatening and require immediate medical attention. There are several types of ventricular arrhythmias, including 1. Ventricular tachycardia, VT. This is a rapid heart rate that starts in the ventricles and can cause the heart to beat too fast, making it difficult for the heart to pump blood effectively. 2. Torsades 1. This is a specific type of VT that causes the heart to beat irregularly and can lead to sudden cardiac arrest. 3. Ventricular fibrillation, VF. This is a rapid and irregular heartbeat that causes the heart to quiver instead of pumping blood effectively. It can lead to sudden cardiac arrest and is a medical emergency. 4. Premature ventricular contractions, PVCs. This is a type of arrhythmia where the ventricles beat too soon. Ventricular arrhythmias can occur in people with underlying heart disease, electrolyte imbalances, or after a heart attack. They can cause symptoms such as dizziness, fainting, chest pain, and shortness of breath. Treatment for ventricular arrhythmias may include medications, implantable cardioverter defibrillators, ICDs, or catheter ablation, which is a medical procedure that destroys the abnormal heart tissue causing the arrhythmia. What are the types of bradyarrhythmias? Bradyarrhythmias are abnormal heart rhythms characterized by a slow heart rate, usually less than 60 beats per minute. They can be caused by a variety of factors, including medications, heart disease, or an imbalance in the body's electrolytes. Bradyarrhythmias. There are several types of bradyarrhythmias, including 1. Sinus bradycardia. This is a slow heart rate caused by a problem with the heart's natural pacemaker, the sinoatrial (SA) node. It is characterized by a heart rate less than 60 beats per minute. 2. Heart block. This is a condition where the electrical signals that control the heartbeat are delayed or blocked as they pass through the heart's conduction system. There are 3 degrees of heart block, with the most severe degree requiring immediate medical attention. 3. Sick sinus syndrome. This is a group of disorders that affect the SA node and can cause the heart to beat too slowly, too fast, or irregularly. 4. Bradycardia tachycardia syndrome. This is a condition where the heart alternates between a slow and fast heart rate. 5. Bundle branch block. This is a condition where there is a delay or blockage in the electrical signals that pass through the bundle branches of the heart's conduction system. Bradyarrhythmias can cause symptoms such as fatigue, weakness, dizziness, and fainting. Treatment for bradyarrhythmias may include medications, pacemakers, or other medical procedures, depending on the underlying cause and severity of the arrhythmia. How is an arrhythmia diagnosed? An arrhythmia, or abnormal heart rhythm, can be diagnosed through a variety of tests and procedures. Here are some common diagnostic methods used for arrhythmia. 1. Electrocardiogram, ECG. This is a non-invasive test that records the electrical activity of the heart. It is the most common test used to diagnose arrhythmia. During an ECG, small electrodes are attached to the skin of the chest, arms, and legs to record the heart's electrical signals. 2. Holter monitor. This is a portable device that records the heart's electrical activity over a period of 24 to 48 hours. It is used to diagnose arrhythmias that occur infrequently or intermittently. 3. Event monitor. This is a portable device that is worn for several weeks or months to record the heart's electrical activity when symptoms occur. It is used to diagnose arrhythmias that occur sporadically. 4. Echocardiogram. This is a non-invasive test that uses ultrasound waves to create images of the heart. It is used to diagnose underlying heart conditions that may be causing arrhythmia. 5. Stress test. This is a test that is used to evaluate the heart's response to exercise or physical activity. It is used to diagnose arrhythmias that occur with exertion. 6. Electrophysiology study, EPS. This is an invasive test that is performed in a hospital setting. During an EPS, small catheters are inserted into the heart through a blood vessel in the groin or neck. The catheters are used to record the heart's electrical activity and to stimulate the heart to induce arrhythmia. The type of test or procedure used to diagnose arrhythmia depends on the type and severity of the arrhythmia, as well as the patient's overall health and medical history. It is important to see a healthcare provider if you experience symptoms of arrhythmia, as early diagnosis and treatment can help prevent serious complications. Complications. What are the complications of arrhythmias? Arrhythmias, or abnormal heart rhythms, can lead to several complications, including 1. Heart failure. Persistent arrhythmias can lead to weakening of the heart muscle and heart failure, a condition in which the heart is unable to pump enough blood to meet the body's needs. 2. Stroke. Certain types of arrhythmias, such as atrial fibrillation, can increase the risk of blood clots forming in the heart, which can travel to the brain and cause a stroke. 3. Sudden cardiac arrest. Ventricular arrhythmias, such as ventricular tachycardia or ventricular fibrillation, can cause sudden cardiac arrest, a condition in which the heart suddenly stops beating. This can be life-threatening if not treated immediately. 4. Tachycardia-induced cardiomyopathy. Chronic tachycardia, or a rapid heart rate, can cause cardiomyopathy, a condition in which the heart muscle becomes weak and unable to pump effectively. 5. Syncope. Certain types of arrhythmias, such as bradyarrhythmias, can cause syncope, or fainting, due to a lack of blood flow to the brain. 6. Reduced quality of life. Arrhythmias can cause symptoms such as palpitations, dizziness, and fatigue, which can reduce a person's quality of life. It is important to diagnose and treat arrhythmias promptly to prevent or manage these complications. Treatment options may include medications, lifestyle modifications, or invasive procedures, such as catheter ablation or implantation of a pacemaker or defibrillator. How is an arrhythmia treated? The treatment of arrhythmia, or an abnormal heart rhythm, depends on the type and severity of the arrhythmia, as well as the underlying cause. Here are some common treatments for arrhythmia. 1. Medications. Antiarrhythmic medications are used to control the heart's rhythm and prevent arrhythmias from occurring. Other medications, such as beta blockers or calcium channel blockers, may also be used to control the heart rate. 2. Cardioversion. This is a procedure that uses a low-voltage electrical shock or medications to restore the heart's normal rhythm. 3. Ablation. This is a minimally invasive procedure that uses radiofrequency energy or freezing to destroy the tissue causing the arrhythmia. 4. Pacemaker. This is a small device that is implanted under the skin of the chest or abdomen. It uses electrical impulses to regulate the heart's rhythm. 5. Implantable cardioverter defibrillator, ICD. This is a device that is similar to a pacemaker, but can also deliver a high-voltage electrical shock to restore the heart's normal rhythm if a life-threatening arrhythmia occurs. 6. Lifestyle changes. In some cases, making lifestyle changes, such as reducing stress, quitting smoking, or limiting alcohol and caffeine intake, can help prevent arrhythmias. The type of treatment used for arrhythmia depends on the type and severity of the arrhythmia, as well as the patient's overall health and medical history. It is important to see a healthcare provider if you experience symptoms of arrhythmia, as early diagnosis and treatment can help prevent serious complications. What medications treat arrhythmias? There are several types of medications used to treat arrhythmias, or abnormal heart rhythms. The type of medication prescribed depends on the type and severity of the arrhythmia. Medications. Here are some common types of medications used to treat arrhythmias. 1. Antiarrhythmic medications. These medications are used to control the heart's rhythm and prevent arrhythmias from occurring. Examples include amiodarone, flecainide, propafenone, and sotalol. 2. Beta blockers. These medications slow the heart rate and reduce the heart's workload, which can help prevent arrhythmias. Examples include metoprolol, atenolol, and propranolol. 3. Calcium channel blockers. These medications relax the blood vessels and reduce the heart's workload, which can help prevent arrhythmias. Examples include verapamil and diltiazem. 4. Digitalis. This medication is used to treat atrial fibrillation and heart failure by slowing the heart rate and increasing the strength of the heart's contractions. 5. Blood thinners. These medications, such as warfarin, dabigatran, rivaroxaban, and apixaban, are used to prevent blood clots and reduce the risk of stroke in people with certain types of arrhythmias, such as atrial fibrillation. 6. Other medications. In some cases, medications used to treat other conditions, such as hypertension or heart failure, may also help control arrhythmias. It is important to take medications as prescribed and to follow up with your healthcare provider regularly to monitor the effectiveness and side effects of the medication. Some arrhythmias may require a combination of medications or other treatments, such as cardioversion or ablation, to effectively control the heart rhythm. What invasive therapies are used to treat arrhythmias? There are several invasive therapies that may be used to treat arrhythmias, which are abnormal heart rhythms. These therapies are generally reserved for more severe or difficult to treat arrhythmias that do not respond to medication or lifestyle changes. Here are some common invasive therapies used to treat arrhythmias. 1. Cardioversion. This is a procedure that uses a low-voltage electrical shock or medications to restore the heart's normal rhythm. It may be done as an outpatient procedure, or in more severe cases, as an inpatient procedure under general anesthesia. 2. Catheter ablation. This is a minimally invasive procedure that uses radiofrequency energy or freezing to destroy the tissue causing the arrhythmia. During the procedure, thin, flexible wires called catheters are threaded through a vein in the groin or arm to the heart. The tip of the catheter is then used to deliver energy or freezing to the targeted tissue. 3. Implantable cardioverter defibrillator, ICD. This is a device that is similar to a pacemaker but can also deliver a high-voltage electrical shock to restore the heart's normal rhythm if a life-threatening arrhythmia occurs. The ICD is implanted under the skin of the chest or abdomen, and thin wires called leads are threaded through a vein to the heart. 4. Pacemaker. This is a small device that is implanted under the skin of the chest or abdomen. It uses electrical impulses to regulate the heart's rhythm. Pacemakers are typically used to treat bradycardia, or a slow heart rate, but can also be used to treat certain types of arrhythmias. These risk factors include smoking. Smoking is a major risk factor for heart disease and can increase the risk of arrhythmias. Nicotine and other chemicals in tobacco can cause damage to the heart and blood vessels, which can lead to abnormal heart rhythms. Alcohol consumption. Excessive alcohol consumption can increase the risk of arrhythmias, especially atrial fibrillation. Alcohol can cause electrical and structural changes in the heart, which can lead to abnormal heart rhythms. Caffeine consumption. Caffeine is a stimulant that can increase the heart rate and cause palpitations in some people. While moderate caffeine consumption is generally safe for most people, excessive consumption can increase the risk of arrhythmias. Stress. Stress can trigger arrhythmias in some people, especially those with underlying heart disease. Stress can cause the release of hormones that can affect the heart's electrical activity and increase the risk of abnormal heart rhythms. Lack of physical activity, sedentary lifestyle and lack of regular physical activity can increase the risk of heart disease, which in turn can increase the risk of arrhythmias. Regular exercise can help reduce the risk of heart disease and improve heart health. Obesity. Being overweight or obese can increase the risk of heart disease and arrhythmias. Obesity can lead to high blood pressure, high cholesterol, and diabetes, all of which can increase the risk of arrhythmias. Sleep apnea. Sleep apnea is a sleep disorder characterized by pauses in breathing during sleep. It can increase the risk of arrhythmias, especially atrial fibrillation. Managing these lifestyle-related risk factors through healthy habits such as regular physical activity, a healthy diet, avoiding smoking and excessive alcohol consumption, and stress management techniques can help reduce the risk of developing arrhythmias. How do I take my pulse? Taking your pulse is a simple and easy way to check your heart rate. Here are the steps to take your pulse. Find a quiet and comfortable place to sit down. Locate your pulse on your wrist or neck. You can check your pulse on the radial artery in your wrist by placing 2 fingers, index and middle, on the inside of your wrist, just below the base of your thumb. You can also check your pulse on the carotid artery in your neck by placing 2 fingers, index and middle, on the side of your neck, just below your jawline. Press lightly with your fingers until you feel a steady pulse. Count the number of beats you feel in 60 seconds. Alternatively, you can count the beats for 15 seconds and then multiply the result by 4 to get the beats per minute. Record your heart rate and repeat the process a few times to ensure accuracy. It is important to note that heart rate can vary based on physical activity, emotions, medications, and other factors. If you have concerns about your heart rate, it is best to consult with a healthcare provider.